Aging and Dual Sensory Impairment. This DVD aims to give people working with older people a greater understanding of the issues associated with vision and hearing loss and the impacts of dual sensory impairment. It will outline strategies to assist in reducing the impact of combined vision and hearing loss. As people get older, there is a greater likelihood of deterioration of both vision and hearing. Causes of vision and hearing loss.
The main causes of hearing impairment in older people are otosclerosis, which causes a conductive hearing loss and affects the middle ear, and sensory neural hearing loss, which is a nerve deafness and affects the inner ear. The main causes of vision impairment are age-related macular degeneration. This causes a loss of central vision, cataracts, which cause blurring, glaucoma, which results in increased pressure in the eye and results in tunnel vision, and also diabetic retinopathy. This causes patchy vision.
Identifying sensory loss.
Combined vision and hearing impairments can result in symptoms which look quite similar to dementia, so it's really important that older people regularly have their vision and hearing checked. Some of the signs that someone's hearing might be deteriorating are that they start complaining people are mumbling or speaking too softly. They might have trouble hearing you when you're not facing them and need you to be facing them all the time. They might start turning up the volume on the radio or the television, and they might have trouble hearing you talking on the telephone. Signs that people's vision is deteriorating are that they might start holding things a lot closer, needing brighter light to be able to see things. They might start complaining of glare, and they also have trouble recognising people, seeing faces, and you might notice that they start having more accidents or bumping into things.
Additional age-related issues.
Ageing can also cause other issues as well as reduced vision and hearing. It can result in increased physical frailty, hypertension, diabetes, which as well as possibly causing vision impairments can cause a number of other health issues, and increased risk of stroke or progressive neurological disorders. When working with older people, it's important to take all of these things into account.
Communication. Communication is an issue for anyone with dual sensory impairment, as they typically experience difficulty lip reading, hearing soft or high-pitched sounds, seeing facial expressions, reading turn-taking signals during conversation, concentrating for long conversations, and hearing with background noise or over long distances. So it is important to implement the following strategies to optimize good communication. Modify the environment by reducing background noise, reducing reverberation or echo, reducing distance, considering lighting, considering contrast, sitting on the person's preferred side, or ensure the person is wearing their glasses and hearing aids and that the hearing aids are on and working. Modify your speech by speaking slowly, speaking clearly, maintaining a good volume, maintaining eye contact, using shorter sentences, and pausing between sentences. Modify the conversation by getting the person's attention and introducing yourself before speaking. Pause to give the person time to respond or ask for clarification. Rephrase if the message hasn't been understood, and be aware of the person's facial expression, which may indicate they haven't heard your message. Mobility. As well as issues with communication, all people with dual sensory loss will experience difficulty orienting themselves and moving around, particularly in unfamiliar environments. Older people with dual sensory impairments will benefit from orientation and mobility training from a qualified orientation and mobility instructor. Many may prefer to use sighted guide when another person is present. Sighted guide. When guiding a person with dual sensory impairment, tap the back of their hand so they can locate your arm. They will grasp your arm just above the elbow. Walk with your arm relaxed, one step ahead of the person. Let them know when you are approaching obstacles such as stairs, doors, roads or narrow pathways. Talk about key landmarks in the environment to help orient the person. To optimise people's independence in moving safely, ensure good lighting. Reduce background noise and reverberative surfaces. Maximise contrast of key features of the environment, for example, door handles, door frames or the edge of steps. Reduce dangers and hazards, for example, open doors or objects left in pathways. Isolation. People with dual sensory loss often experience considerable isolation due to difficulties in communication and their reduced independence. It is important to take the time to learn how best to communicate with each individual and learn about their likes and preferences. Now we will hear about the experiences of 3 older people with combined vision and hearing impairments. Gillian.
So I was wondering if you could tell us about what this piece of equipment is and what you do with it.
It's CCTV. One of the problems of macular degeneration is reading fine detail, and so anything in print is difficult to read. So with this machine, I can read my mail, and I like to do crosswords, so that's nice. And I don't read books because I get a headache. So, but it's possible to do that. I can change the brightness and it's got more than one colour. I can do knitting with it because the main problem I find with knitting is that I drop stitches, so I tend to count how many stitches are on the needle every 3 or 4 rows, and if I've one short, I've dropped one, so I can put it under in the front of the CCTV and use a crochet hook and pick up I can find the stitch in the first place and then pick it up, so I can see better to put my lipstick on if I want to, so that's handy too. It's in 2 pieces. This piece has a microphone at the side which picks up the sound and transmits it to the piece I'm wearing around my neck, and that in turn transmits it to the hearing aids when they're switched into the T switch, listening to the talking books. That's all I'm hearing. I'm not hearing, if I've got both hearing aids in the T switch, I'm fully focused on the talking book and not what's happening around me. So this works as an aerial, so you point that in the direction of the person. You point the whole thing in the direction of the person who's talking to you. If you're struggling to hear, then and you've got 4 people, you're sort of twisting it round like this all the time, so it's a bit, but it's better than nothing. Yeah. I've got a Zoom text keyboard which I should use. I tend to use the mouse and sometimes the keyboards, you know.
The keyboard commands?
Commands, yes. But it would be more sensible to use I tend to use both. So.
And Jill, what do you mostly use the computer for?
Email, looking things up, Skype, because we've got a son in Germany, so once a week we talk to him on Skype.
Betty.
Hello, Mum. Hello, Mama. Hello, Eleanor. Come on, I'll give you a hug.
Oh,
Hello.
Do you know the name of the vision condition?
Macular degeneration, yes.
And how old was Betty when her vision first
I
started?
think Mum was maybe 80. With the hearing, Mum has worn hearing aids since she's about 40. And
14.
no, 40.
What about it?
I can remember when I was a child, you getting a hearing aid.
Oh my
And to
goodness.
start with, you only had one.
Oh.
And then, I don't know, when Mum was maybe 65, 70, she got two. And then about maybe 3 or 4 years ago, there was no point, maybe longer than that, there was no point in wearing two, so she just wears one now. And here with the telephone, I've organised with the clinical services coordinator that we need to ring the main phone first, and then somebody will come and get Mum, and she'll be ready waiting for 5 minutes, and then we ring her direct line.
Right.
Because otherwise Mum can't hear that the phone's going.
Okay.
I miss it because I'm too slow, because I can, hear it and start, but I'm too slow to get here.
And then it can be hard to find exactly where it is on the table too, isn't it, with the vision?
Yes, that's right.
Just so that Mum doesn't accidentally wheel down the stairs. There is a door there, but it was often open, so I've asked for something to be done about that, and they've got a really good sign up saying, please to always remember to shut the door.
Great.
And also I've got this little note here on the table to the carers with phone numbers, asking them to dial the number for Mum when she needs to make a call, when she wants to make a call. And Mum always said that the phone was her best way of hearing because it was held directly over her hearing aid. You said that was the best communication you had when you spoke on the phone.
So, Eleanor, you moved Betty from one residential service to here. Can you tell me some of the reasons that you're preferring the service here?
Well, I really appreciate the fact that people come and get Mum to take her to the various activities that are on, and they have a lot of activities. So Mum couldn't possibly find them by herself because she can't see where they are, she can't read where they are. And so, yeah, that's really necessary. So people come and get her. She goes to bingo, which is, of course, extremely hard for her because she can't see the numbers and she can't hear the numbers that are called. But a volunteer sits beside her and helps her with that.
Right.
She goes to the exercises, and they have entertainment once or twice a week when they have people who come in. They have dancers, they have singers, and Mum enjoys that. And they go on bus outings. Mum enjoys that. Well, just the fact that they don't forget Mum. They come and get her and take her to the activities is really good.
Okay.
And I've been told that Mum always says yes. She always goes to the activities. She never says no. So that's really good.
It's a good sign. Great.
Vic.
And what about communicating with people? How do you communicate?
Oh, it depends if they're deafblind or communicate with sign language. But if they're not deafblind, we just talk with them. That's because I've got the cochlear implant. My voice is okay. There's nothing wrong with voice, which is unusual because most people who are deaf have got a speech defect, which I haven't. So I don't know why. But now before I got the cochlear implant, I was dependent mainly on sign language and lip reading. But as my eyesight's fading now, I can't depend on lip reading because I can't see the lips are not clear or blurred.
So what sorts of things can people do to help with communication with you?
To make sure they face me and speaking clear when they're talking, or signing slower. I can't pick up the sign too fast.
Okay.
It
And
must be close.
what about noisy places?
Big problems. Okay, on the background, they're always interferes with the cochlea.
Adapting to vision and hearing loss associated with aging can be very challenging. However, there are a number of strategies, aids and equipment which can assist to maintaining good communication and independence. Patience, a sense of humour and a positive attitude will also go a long way to reduce the impacts of dual sensory impairment.